Hey guys, given everything that's going on in the world right now, we wanted to talk about how the coronavirus is impacting immigrants. Public health experts are extremely worried about a potential outbreak of the coronavirus on immigrants in camps alongside the southern border, in detention centers, and in the communities. This is an unprecedented time and governments are responding as best as they can. But immigrants and refugees always seem to get the short end of the stick. That's why it's really disappointing to see the Trump administration doubling down on its anti-immigrant policies at a time where we need smart public health leadership and a humanitarian outlook. Halting asylum applications, continuing to build the border wall, and refusing to legalize Dreamers, where 27,000 of them are healthcare workers that are so needed right now, are all signs that the administration is determined to continue its anti-immigrant course despite the unprecedented danger.
The administration has not had a clear response in terms of immigrant communities. We're especially concerned about enforcement and scaring the community and making people fearful to seek assistance. It's also been very confusing because the administration has said that they might scale back enforcement, but then leaders like Ken Cuccinelli have said that they're going to continue enforcement at the same levels. And then they have not shut down all operations. They still have tens of thousands of people in detention. They still have USCIS requesting papers for deadlines. They have suspended USCIS in-person interviews and biometric appointments, but they have not suspended all court hearings. They've just suspended some of them. So it's just been a really patchwork response.
When we talk about ICE detention centers and a possible, outbreak in those, we're talking about the immigrant community as if it's isolated from the rest of America. Can you talk about how those are actually very integrated, and are they?
Yeah, no, exactly. I mean, everyone is living in the same space, breathing the same air. I mean, we can't separate out a whole community. And so everyone has to have access to testing and treatment. You can't have one population that doesn't have access to that, or else you're putting everyone at risk.
ICE detains nearly 38,000 people in more than 200 private and state-run jails and prisons across the country, many of which sit in rural areas and operate with minimal public oversight. Medical experts warn that an outbreak in an ICE detention facility is inevitable as the pandemic spreads and the number of cases in the US rises quickly. More than 3,000 physicians just signed a letter urging ICE to release detainees while their legal cases proceed. I spoke with Dr. Kate Sugarman, who's one of the pioneers of this effort.
So the letter was started, a group of doctors and lawyers and I together came up upon the idea, and it just caught on extremely quickly. The only thing that needs to be done at this point is to release people. Prior to the pandemic, health conditions in ICE jails are horrific. And so now when you add a pandemic that is extremely contagious, extremely airborne, and requires social distancing, that people need to be released immediately before there are mass deaths.
Immigrants in crowded detention centers are particularly vulnerable to contracting the coronavirus. It's unclear what the administration is doing to protect immigrants and our communities. After all, the virus does not discriminate based on immigration status. Follow us on social media to keep track of this important issue, and see you guys next month.